Okay, good. I'm Dr. Firnhaber, as you know, and tonight we're going to talk about how not to short circuit the brain. Now, let me ask you guys some questions. Do you think that it is possible to short circuit the brain? And what are some of the ways that we could do it?
Well, you can short circuit your brain by not getting enough sleep.
Okay. Not getting enough sleep. Okay.
Yeah, if the brain doesn't have the right nutrition to function well.
Bad nutrition. Yeah. Anybody else?
Those are my two.
Okay. All right. Good. So tonight we're going to learn several things. Number one is we want to learn the role of the nervous system in the health and disease and how that can be short-circuited. We're also going to learn that the power that made the body heals the body, and the body heals from above down, inside out. Now, if we look at this model of the brain, we call it the safety pin model. We know that we have this built-in rescue mechanism in our body. We call it the safety pin cycle. And if we look at the safety pin, the upper part would be the brain, the lower part would be the body, and this is a nervous system connecting the brain and the body. And when you're subluxated, meaning there's an interference between the brain and the body, the brain is literally short-circuited. Now, all primary doctors who care for people with the intention to enhance and express their life and express health, they know this, they understand this. If we look at how the brain, these messages work, and this law is not just privy to chiropractors. I'm not talking about a chiropractic philosophy. This is a scientific fact. The brain sends messages to the body, that's the efferent system. The body responds and gives feedback back to the brain. That's the afferent system. The way you can remember that is this effervescent messages out of the brain to the body. That would be the efferent. So anyone that does not know this or respect this is violating one of the fundamental laws of life before, if they administer or implement a diagnosis without understanding this. So how important is the nerve supply from the brain to the body? Let's look at bad scenario number one, the guillotine. What happens when a head is severed from the body? Just boom.
You die.
You die instantly, okay? So what is it that kills you?
Well, it's the nerves not connecting to the body any longer.
Yeah, unless you have electrical energy from the brain to the body, you can't survive. You can't function. So it's that electrical energy that's instantaneously cut off from the brain to the body. And this poor guy is saying it's not the same. I was caught stealing office supplies. You, on the other hand, got caught stealing ideas. So it's kind of a funny cartoon. Look at bad scenario number two. We've got Christopher Reeves. So what happened to Christopher Reeve?
His spinal column's broken.
Yeah, he severed his neck, right at the top of his neck, and he partially severed his spinal cord. So it paralyzed him from the neck down, okay? And so this is a partial severing of the nerve supply from the brain to the body. Much, but not all of the nerve supply is cut off. So this is a pretty major short-circuiting of the brain, but not completely severing. Let's get bad scenario number three. Bad scenario number three is subluxations interfering with the nerve supply from the brain to the body. Now, a minor subluxations, we know, can cut off 60% of the nerve flow to an organ or a muscle. So chiropractors are trained to correct this. Now, here's a subluxation. Here, degeneration, and I see a lot of this in my office. If you let that go, that will destroy your spine. Once you start getting this kind of degeneration, that's like rotting from the inside out. And if you let it go and you don't do anything about it, it will actually devastate your spine. Now, it won't do it overnight. It takes time to do that. But this situation here can be slowed way down with chiropractic care. And this is, you see here, we've got some nerve inflammation on the nerve root that's happening right there. So what would happen, you think, if you got inflammation in your nerve root that goes out to your arm?
Your arm's not going to work right, or it's going to be in pain.
Could get weakness, could get pain, could get numbness, could get tingling. Okay, so the origins of life is triggered by what happens in the brain. The brain is constantly doing its best to make endless observations and give the body as much health and life as possible. There's no evidence that a healthy brain can produce an unhealthy body. So even if you don't exercise and you eat French fries and chicken nuggets all the time for what you eat, the brain is going to do its best to give you as much health and life as possible. Now, the central nervous system starts with two cells, sperm and the egg, which come together and start dividing. The first thing that happens is what's called the notochord. The brain and the spinal cord are formed. Very first thing. Off the brain and the spinal cord grow the organs which make up the body. So the flow of organ, the flow of how the organs are developed are directed by the brain and the spinal cord. Now, the body tries to protect things appropriately. So we have, is it a coincidence that your brain and your spinal cord are protected by bone? No, vital organs are protected by bone. Bone by weight is 9 times stronger than steel. Now, subluxations have been described in different ways. It's a dysfunction of a joint irritating a nerve, inflammatory process of ligaments and discs. So there's an inflammation in that area caused by a joint that doesn't move properly. It's outright compression of a disc, or it's a change in tissue tone caused by a change in the electrical field around that area. There's 4 different ways that we describe nerve interference in the body. Now, I want to understand this. I want you to understand, we're going to talk about the prefrontal cortex of the body. Chiropractic adjustments change processing here in the prefrontal cortex. This is published research. Now, the prefrontal cortex modulates our mental health, our immune system, inflammation, endocrine, gastrointestinal issues, pain and stiffness, sleep, high blood pressure, high heart rate, attention and focus. That's all modulated in the prefrontal cortex right up here. So we know that chiropractic adjustments change processing here. Now, this is where we talk about short-circuiting the brain, because the prefrontal cortex is the brain's conductor. Chiropractic care impacts that. So pain, when you feel pain anywhere, pain may be coming from here more than here because we process pain in the brain. So you have a bulging disc down here, but that's causing a short circuit or a problem in the prefrontal cortex. So the prefrontal cortex adapts to that pain and expresses pain. So here, the prefrontal cortex is a rational thinking part of our brain. That's how we make executive decisions. And I want to show you something about how the brain works and how we can short circuit it. So if you take your thumb and you put it here, wrap your fingers around, do that. Okay. So if this is the brain, this is the brain stem right here. The brain stem is the part of our brain that monitors our breathing, heart rate, blood pressure, and that. This, the thumb, is the limbic system, which manages our emotions. And the 4 fingers over the thumb is our prefrontal cortex, which helps us control our emotions. Now think about this. What happens when somebody's under a lot of stress? These fingers start disconnecting from the emotional part of the brain. And what do you think happens then? Any idea? People do things that they normally wouldn't do or they shouldn't do. You know, they'll hit people, they'll kill people, they'll yell at people, they'll do things under stress that they wouldn't normally do. So stress unlocks or unhinges the prefrontal cortex from the limbic system of the brain, which is right here. So what chiropractic care does is chiropractic care helps bring those fingers over the limbic system. It helps us, the prefrontal cortex, function better, which helps the immune system, can help with blood pressure, can help with decision making, all kinds of things. So a subluxation anywhere in the body can affect the prefrontal cortex, and that's what causes a short circuit in the brain. So if you look at the scientific evidence out there proves that people with this form of a dysfunction, when adjusted, reveals a response that enhances function and decreases problems. Okay, so there's 3 ways to look at chiropractic. Okay, there's the I don't believe in chiropractic. Anybody ever heard that?
Mm-hmm.
Yeah. I mean, I've heard it, and I am a chiropractor. Okay. And so, there are people that they don't understand or they don't want to understand. And so they just don't believe in it. Here's another one. Chiropractic is only good for pain relief. I go to my chiropractor when I hurt. When I don't hurt, I don't go. Okay? So let's go back to that situation I showed you earlier where you have a degenerative disc in your body that's degenerating over time. So what do you think? If that person goes and gets adjusted twice a year, only when they're in pain, is that disc continuing to degenerate?
Mm-hmm.
Yeah.
It is. Yeah. So you can have no pain in your body and have your disc degenerating. Okay, so chiropractic is actually a form of preventative health care because not only are we correcting and fixing the prefrontal cortex when you get adjusted and enhancing its function, but you're slowing down the degenerative process in the spine. And how many spines do we have?
Just one.
One. Can you get a spine transplant?
No.
No. You get a liver transplant, lung transplant, kidney transplant. You can't get a spine transplant. So the third way to look at chiropractic, it enhances the way my entire body works, and thus the expression of life and organ function. So the pain relief, chiropractic is not designed to make you instantaneously feel better. It's designed to make you instantaneously heal better. So not every one of my patients, when I adjust them, walks out and says, man, I don't have any pain, or the pain is less, or I feel great. Not everybody does that. What I'm looking for is over time, how is your body healing? Are you able to function better? Are you able to move your neck better? Are you able to do your activities of daily living better? Are you able to play with your grandkids in ways you couldn't do that before? That's what I'm looking for. So when I adjust somebody, that produces healing responses in the body for hours and sometimes even days. Okay, but you don't always feel it. And here's an example. When all of us have gone to the doctor at some point in our lives, or gotten an over-the-counter painkiller and taken it. So let's say you have pain. Let's say you got tooth pain. You got a toothache, especially you had some dental work and your jaw hurts. So if you take a Tylenol or an aspirin, does the pain go away as soon as you take it?
No.
No, it doesn't. You don't even expect it to, okay? So you have to take it over and over and over, and then the pain begins to diminish. Well, chiropractic care, and I don't like comparing it to a drug, but it isn't always instantaneous either. But the healing responses that it releases in your body when you get adjusted accumulate over time. So if you study the loop between the brain and the body, you think a liver trying to detoxify a toxic body needs the information travel from the brain to the body, and the body to the brain 100%.
Mm-hmm.
Now, I'll say this, I see livers all the time that aren't working. I see them every day in practice. You know, and I use supplements to help it, I use laser, I use several things, but I see livers constantly that aren't working right. People didn't even know it. They had no idea their liver wasn't working, okay? So, another thing that I want to say is this, is that the liver, which is the largest organ in the body, has attachments to your neck and to your lower back. So a liver that's not working right, that's not moving correctly, can contribute or cause neck pain and or low back and sciatic pain. So a liver that's not working properly can actually contribute to spinal pain. Now, do you think a heart requires 100% nerve flow without interference to work properly? Mm-hmm. Sure it does. Of course it does. So Keith Wasson, he's a creator of the videos I have up there that I show on a regular basis, stated that thinking of chiropractic as only pain relief is like robbing a bank and stealing only the pence. Okay? Chiropractic is so much more than pain relief. It's a system of health care that keeps the body healthy and strong. Recently, in fact, this just happened a couple weeks ago, I have a whole family that comes to me. And the woman said to me, the wife said, you know, I didn't have to go to a doctor the whole year. And she says, I think it's because I come here. Okay? Now, I see her kids, I see her husband. They rarely have to see a physician. They come here, we adjust them, and they stay healthy for the most part. So let's look at the way our culture looks at things. So how about the idea of cortisone? So you got back pain, well, you know, you can get a cortisone injection, and it may and may not work. By the way, do you know how much a cortisone injection costs your back? Anybody, any idea? It's $1,500, and that doesn't include the office visit. So the office visit's $200. The cortisone injection is $1,500, so it's $1,700. You get a cortisone injection in your spine, okay? And that may or may not work. But even if it does work, what's it doing?
It's masking the pain.
Yeah, it's covering it up. It's artificially covering up the pain, artificially decreasing the swelling. Now, I'm not saying that nobody should ever get a cortisone treatment. I'm not saying that. What I'm saying is that you get a cortisone treatment and the pain goes away, you can go back and injure that thing even worse. So this would be my second to the last option that I would go for. The last option would be surgery itself. So this is crisis intervention. This isn't what I would call healthcare. It's crisis care. What is the difference between healthcare and crisis care?
One's preventative and the other is after the fact trying to solve a problem that's gotten really pretty far along.
Exactly. So healthcare is you're producing health in people. So I don't know of anything done right now in medicine that actually makes people healthy. There's things they do that will get rid of pain, that will fix problems that come up. But are you really any healthier after they're done? Does it produce health in your system? Well, that's pretty debatable whether it does or not. You know, I don't know. I mean, obviously some things they do are really good. People really need it, and I'm not saying they don't. but does it really produce health? That's the question. So in December 2019 study in the journal Radiology said that the following regarding steroid injections. They tend to accelerate osteoarthritis. They can cause subchondral insufficiency fracture. They can cause the bone to die. That's called osteonecrosis. And they can cause rapid destruction with bone loss. These are side effects, possible side effects of cortisone injections. So it's not a completely safe procedure and not without its risks. So while the chiropractic process may be slower than a shot, it's much more in tune with your body's need to feel safe. You know, if you have pain, you have it for a reason. So covering up symptoms is like, you know, taking a screwdriver and punching out the oil light in your car when the oil light comes on and says, well, it's gone, I guess we're okay. And getting just enough chiropractic care to get rid of your pain when you got degeneration in your spine is like putting just enough oil in the oil pan to get the light to go off. Okay? You go, well, the light's off, so I must be okay. Well, not really, all right? So, again, research has shown that even a minor subluxation can shut down 60% of the nerve flow. Only 10% of your nerves deal with pain. The rest of your nerves support function. So, so what would be an example of nerve supporting function? Anybody?
Well, they really drive almost every organ's function.
Yeah.
Right? Like adrenals, for example.
Sure, adrenal glands, which release cortisol and other hormones, sex hormones. But just your ability to, like, lift this up, that's function, okay? Your ability to move is function. So your most of the nerves in your body control function, not pain.
Mm-hmm.
Okay, so if you have a subluxation and you have no pain, can you have a loss of function? Absolutely you can. See, this is the issue, is people that think chiropractic is only for pain. Only 10% of the nerve supply in your body deals with pain. The rest of it deals with how we function. And so that's why I do all those tests when people come in to see me. Grip strength, range of motion, balance. I want to look at how well they're functioning. I mean, their pain is important. I'm not saying I don't care about that, because I do. But I want them to function better on their re-exam. And most people do. So an individual who has a nervous system free of interference can fight off infections and sickness much easier. You think the nervous system is connected to the immune system?
Mm-hmm.
Mm-hmm.
Yeah, okay. How so? Anybody? Where's most of our immune system located?
Gut.
Yeah, in the gut. Good job, Paul. Yeah, so where is the second majority of neurons or nerves in our body? What part of our body is it in? So you have the brain, the spinal cord, but what's the second most densely populated area of nerves?
Spinal cord, you said?
It's around our gut.
Oh.
There's more nerves in our gut than there are in our spinal cord. So what happens is, if that's the case, and most of the immune system is in our gut, then there's a correlation, a direct relationship between the nervous system and our immune system, and that's tied into the brain and spinal cord. So let's look at kids. Children who are subluxated may not feel pain, but they may get chronic colds, allergies, food intolerances, behavioral issues, ear infections, sore throats, all which stem from interference a short circuiting of the brain from the brain to the body. So if a kid has chronic ear infections and sore throat, is that a amoxicillin deficiency?
Mm-mm.
Is that kid born with a antibiotic deficiency? No, there's a reason. Now, subluxation could be the reason. What's another reason that a kid could have chronic ear infections and sore throats? Anybody? How about their diet? Maybe they're eating, it could be a dairy intolerance. It could be a wheat intolerance. It could be, they might be eating just too much sugar, okay? That could be causing it. So there's an article in a prominent neurobiology journal in 2014 that says this. They were looking at the nerves that come out of the upper neck. They said, these nerves have great influence on the cardiovascular and respiratory area. Stimulation of these areas can influence the cardiovascular and respiratory area. Well, just about every time a person comes in, I adjust this area of the spine. I do it very gently, but I adjust it. This area also influences the entire autonomic nervous system, which influences all the organs in the body, and that constantly, and then homeostasis, biological balance. So this is one reason why it's difficult to understand how chiropractic can work. Some say you have to go back over and over for the rest of your life. Well, you don't have to do that. I mean, you can stop any time. I mean, if you want your spine to degenerate, it's okay. But people, you can stop brushing your teeth. I mean, we don't brush our teeth because our teeth hurt. We brush our teeth because we want to hang on to them, okay? That's why we get adjusted. We want to hang on to our spine and have our nervous system functioning as well as it can. So, if you look at Tour de France riders, they don't get adjusted because their backs necessarily hurt. They get adjusted because they perform better. Racehorses get adjusted. I adjust animals on Saturdays. Why? Because a lot of these animals, they function better. They can get up from a sitting position sometimes where they couldn't before they got adjusted, or they can hop in and out of the car better. The animals don't come in because they tell their owner they have a migraine headache. Their owners look at them and say, hey, my dog can't walk like it used to. And that's why I see these animals. So, horses get adjusted because they run faster when they're adjusted. Bulls produce more semen when they're adjusted. So that's money in the owner's pocket. So, there's so many people out there that are healthy, they're sick, they don't know where to go, they don't know what to do. And, we offer in our office a free, complimentary subluxation check, where we check people and find out, do you have a subluxation? Are you a good candidate for our office? And if you know people that need to be adjusted, that are sick and unhealthy, send them in. Let us at least check them. We do that at our expense. If they're not a good candidate for our office, we send them on their way. And I have done that before. But if they are a good candidate for our office, then we may be able to help them in ways that nobody else can, in ways that pharmaceuticals can't. So, here's some animals. So as doctors of chiropractic, we don't just adjust people to get them out of pain. We adjust people because it's the right thing to do. So I want you to think of people that you might know that might just need to get checked. Doesn't mean they have to become a patient, but Carmen, will be happy to schedule them, and we can find out if we can help them or not. Recently, we just had an elderly woman come in. She walked in with a cane. She was unstable, and she's been in about 6 times now, and she doesn't even need a cane anymore. And she had a bad spine, a really bad spine. So, and now she functions a lot better. She's not nearly as wobbly. She can walk without a cane, and she couldn't do that before she came in. So there's so many people out there like that could benefit from chiropractic. So you can call the office, have them call the office. You can bring them to one of my talks. What's next time's talk on?
Prostate.
Next time we're doing on prostate. It's the first time I've ever done this talk in my office. It's called Understanding Prostate Dysfunction. What causes a prostate not to function? What are the things we can do to make it better? We're going to do that next time. And so I hope you all come back then for that brand new talk. I'm doing several new talks this year. That's one of them. And then we're doing one on sleep down the road in a few months. I've got several new talks that we're going to be working on this year. So next week, it's Understanding the Prostate. We'll see you then.